Hello, it's Ashley and Kyle back for another Lakeside chat, our first one of the season. Unfortunately, torrential rain and wind kind of made us compromise today, but we're moving forward in the correct direction.
So. We were not going to do a fireside chat.
No. Well, today we're going to just do a short talk on pancreatitis, something that we commonly see in practice.
So what is pancreatitis and what causes it in dogs and cats?
So pancreatitis, the pancreas produces digestive enzymes, and when anything eats, these enzymes are released into the pancreas duct to go into the small intestine to help digest the food. During pancreatitis, something malfunctions and those digestive enzymes release too soon, and basically the pancreas starts getting auto-digested. So, yeah.
The organ itself?
Yep, the organ itself. It causes tremendous inflammation to all the organs around it, which are going to be your small intestine, your stomach, sometimes your liver. So a lot of bad sequelae can happen. What causes it? Typically the MO is the dog gets into a high-fat meal, usually gets into the garbage, gets too much steak if they're not used to it especially, and basically it just sends that pancreas into overload, and it stimulates it to auto-digest. And then, yeah.
How serious is pancreatitis? It sounds like it's pretty serious. Can it be fatal?
It can be. Pancreatitis ranges anywhere from mild symptoms to where the dog's just vomiting a little bit to I need to be hospitalized on some IV fluids for support to needing surgery and feeding tubes, and even death can happen on some of them. So.
What are the signs and symptoms I should look for?
So usually we're looking at vomiting, diarrhea sometimes, just a dog that doesn't want to eat, dog walking around arched up because its abdomen hurts, and then a lot of owners will tell me that they see a praying position, so the dog's like play bowing almost. That's because they have abdominal pain, they're trying to get pressure off of it. So those are the really common things. Really, really lethargic, sometimes they have a fever.
You can kind of take this from what you said, that the answer is no, but is pancreatitis contagious to other dogs?
No, it is not.
Pets?
Yeah, no, it is not.
And cats and dogs can both get pancreatitis?
Cats and dogs can both get it. Cats tend to not have the acute version, where cats tend to have kind of a chronic, smoldering, inflammatory version. Usually it's related to small bowel disease. Cats have a little different anatomy there, but they can get the acute version too. So
how is pancreatitis diagnosed?
So pancreatitis is diagnosed by history. Basically, did a dog get into food it shouldn't have? What's the dog's dietary history? Signs, if a dog has fever, really high white cell count, a lot of times we're running blood work on these guys. And there's a test called a CPL, which tests pancreatic lipase. Sometimes if it's really, really high and we have other signs, that tells us that the dog may have pancreatitis. Sometimes ultrasound, will help us with that as well.
So could my pet's symptoms be something else?
Oh yeah, sure. Dogs are common scavengers, so they vomit for a variety of things they eat, anything from rabbit poop to mulch to whatever. So usually we're looking at the signs of the dog. How sick are they when they come in? If they're hopping around, wagging their tail. They can have pancreatitis. It's probably pretty minor. So a lot of times we're running blood work, but we're looking at the patient. How sick are they? Do they have a temperature, fever, those sorts of things.
So my next question is, will they need to be hospitalized? Sounds like not necessarily.
Not necessarily. The mild cases, sometimes we just treat with nausea control, a low-fat diet once they feel well enough to start eating again, and some fluids under the skin. In the mild cases, they're treated as an outpatient. And honestly, I would say, just in my experience here in this practice, I would say 60% of them, that's usually what we end up doing.
What medications will my pet need?
Yeah, so usually they need nausea control, something to stop vomiting and to just stop the nausea in general. And there's a variety of things that we use for that. Serenia is a big one. And fluids under the skin a lot of times. For the dogs that are very sick that need to be hospitalized, they can't eat or drink. They're extremely painful. So those dogs we're doing IV fluids, we're doing intense nausea control, and we're doing pain control as well. So
seems like it really hurts.
It hurt tremendously, and those dogs have like IV morphine sometimes, and lidocaine, and all kinds of things to kind of control their pain.
So they can get pretty darn sick.
They can get pretty sick, yeah.
So how long does it take the average dog to recover from pancreatitis, or dog or cat?
Yeah. So dogs, in the minor cases, usually one day, sometimes two. Moderate cases, several days in hospital, and then the severe cases, we're usually referring those to a 24-hour facility. And frankly, for a dog that we have to hospitalize for it, I always recommend transferring to a 24-hour facility so they can have their fluids monitored and things like that, because it's so important they get their fluids and their pain drips and things like that at an appropriate rate and things like that. So and then those that are becoming complicated, they're in the right place then as well.
I know my pit bull snuck a piece of kielbasa off the table with my kids, little,
that happens,
and he got really sick. And we think eventually it seemed to keep coming back. He would scavenge food in the wrong places, or kids just oops, it was in my hand, now it's in the dog.
Yeah, and there's some that are just really sensitive, and it seems like once they've had it once, they're a little more sensitive to having it in the future.
And that was the next question: is it curable, or will they have it for life? So they could have a sensitivity.
I would say it is curable, yes, but I feel like sometimes they're prone to relapse with the proper stimuli. And then certain breeds of dog are more sensitive to it. So the small terriers, your Yorkie, your Schnauzer, miniature dachshunds, Cocker Spaniels, those are some breeds that are a little more sensitive, although any dog can get it for sure. Also, dogs that have like diabetes and dogs that are obese are a little, more prone as well. So
what should I feed my pet if he has pancreatitis while he recovers? You said low fat. Is that special food or homemade?
Usually it's a special diet. We usually recommend one of the low residue, low fat diets. So these are diets that are highly digestible, and then they're a low fat. So the pancreas doesn't like high fat levels for those that are prone to it. So that usually is ideal. I have some really picky dogs, so sometimes we've done some like hamburger or chicken and rice, something like that, that's bland at home. But for the most part, due to consistency, we're better off with the commercial prescription diets.
Makes sense. Can I give my pet treats, or should those be avoided?
Those probably should be avoided, and you just use your dog food as a treat. And anybody that's been through like a bout of pancreatitis, they're usually not wanting to go back through it. As far as like, it can be a very costly disease or condition, and it can be extensive, and it's just a lot of owners are like, whatever I can do to prevent it. And so just consistency with diet, not having a lot of external things if possible, and then maybe avoiding fat for sure.
Your dog won't want to avoid it, or your cat won't want to avoid it, but you will.
Yeah, that's right. That's right.
And you said it can come back, and how do you prevent it? By feeding regular low-fat dog food, or are they on a special diet for the rest of their lives?
Typically they're on a special diet, for basically the rest of their lives. And then they've been used to the low-fat diet, so when you go to change to something higher fat, I always worry about a trigger there. So honestly, being on the ID low-fat or the Royal Canin low-fat diets, being on those probably. Some of the real minor cases, and I've got picky dogs, they do okay with just commercial maintenance sometimes, but there again, keep it consistent. Don't give them a lot of extra things. I think that's the most important, is consistency as well. So,
should I change my pet's exercise routine?
Probably not. I would say if they're overweight, and they're a little at higher, they might be at higher risk for it. So definitely keeping them fit would be an important thing.
And you talked about the breeds that were most prone to pancreatitis, usually the smaller dogs, probably because they have that face maybe that makes mom and dad give them more stuff, or
I don't know.
Just their tininess.
I think there's just heritability, associated with it as well. And I will find that a lot of the smaller breeds are kind of my table food eaters and things like that a lot of times. So, and a lot of times they'll do okay until they don't, kind of thing. Yeah.
Are there any supplements that you can give them that will help?
No, not really. And some dogs that certain medications can trigger it, like the seizure dogs that are on phenobarbital, they might be a little more prone to it. And then sometimes it just happens. It's just idiopathic. Just for whatever reason, I think the blood supply to the pancreas got compromised for a minute or two, and that set off a pancreatitis bout as well.
So, roughly, can you guesstimate how much a pancreatitis treatment would cost? Do you have any?
Yeah, I would say if we run blood work and whatnot as an outpatient, maybe $400 to $500.
Hospitalization's a whole other ballgame.
You're looking at $250 to $300 a day, and then if you need feeding tubes and surgical resection for an abscess, or the dog starts having clotting disorders or going septic, which means bacteria flooding their body. Those are all side effects. Peritonitis. Those are all complications, not side effects. Those get extensive, and each complication that happens, the prognosis for survival kind of goes down. So,
well, will my pet need to have ongoing veterinary visits more than the 2 that we recommend already?
No, I would say not, as long as they responded well and there's no lasting changes like liver enzyme elevation or something like that.
So if the symptoms come back, when should I bring my pet in?
Probably right away.
Right away.
Probably right away, yeah.
So long-term prognosis is it can come back. It may not if you watch their diet, but even if you do watch their diet, they may be a little more prone to it.
Yeah, right, that's correct.
So,
yeah,
okay.
I feel like in my experience, and whether that's just because a lot of the ones we see are smaller dogs and they're kind of prone anyway, so, I'm not sure.
Well, so if that's not... what am I trying to say? Encouragement enough to not feed your dog a lot of table food, take them to McDonald's, that kind of stuff. The cost of treating them and just the pain and the danger your pet will go through with this. It's so much. We harp on people about table food. I get after my husband for table food. It's just a small bite. Well, yeah, but that's...
Right.
Yeah, just don't do it.
Yeah, maybe do an occasional green bean or a carrot.
Oh wow! I gave Bucky a carrot one time, and he shredded it on the couch, and that's all he did with it.
But it gave him enrichment. So
it cleaned his teeth, I guess.
No, and I can't reiterate how the pendulum can swing. It'll be kind of minor to kind of
life-threatening, like it was my dog. I believe that's what killed him. Just one little piece of hot dog or something. Well, if you have any questions or if you suspect your dog has pancreatitis or anything like it, bring him in right away, get him looked at. But best try to avoid it than to have to deal with it once it's here.
Yeah.
So be very careful, and if you have any questions about it or what you need to do,
give us a ring. We're here.
All the time.
Until next time, we'll be outside, I promise.
Under an umbrella, or maybe it'll snow in May. Who knows? Thanks. See you next time.